We're going to have a panel session, and if we can bring Dr. White and Dr. Braunlin back up, and this is the time for you guys to ask some questions. So who has some questions for our panel?
This question is for Dr. Braunlin. When you talked about coronary artery disease being less likely after BMT, was there a particular age that the children should have had the BMT by? What was the cutoff in age if they had had it by when?
That's a very good question. Fortunately, we don't have much evidence because the evidence comes from autopsy. And so we've only seen 1 or 2 autopsies and looked at the coronary arteries. Those kids were transplanted when they were about 2 years of age and died of pulmonary pneumonia 15, 16 years later, and the coronary arteries looked very nice on those patients. But the other evidence comes from the fact that the natural history would say that kids with MPS I don't live much beyond 10 to 12 years of age, and after bone marrow transplant, there isn't an expiration date, and the kids are living 25, 30 years, and so you have to figure that their coronary arteries somehow are just fine.
Okay, thank you.
Dr. White, you said that carpal tunnel is painless, and he recognizes me because I've said this to him before, sorry. And as a parent of an MPS II child, I can tell you that it is painful, and there's a huge difference after my son had the carpal tunnel surgery release, and I just didn't want it to sort of pass by that if you're newly diagnosed that you would think your child is not in pain if they have carpal tunnel. So what are you basing your statement, what evidence do you have that you're thinking it's painless?
I've never seen a child who acted like they were in pain, and I've taken care of 40 plus kids with MPS and carpal tunnel. So I didn't say it couldn't be painful. What I said was it's usually painless, and that you shouldn't be waiting for pain symptoms, because if you wait for pain symptoms, you probably waited too long.
So I just want to comment on Klane. I agree that there is pain occurs, but if you have pain, it's way, way too late. But some of the kids are very uncomfortable that I've seen, so I think it's important to realize, this idea that they're painless is really, I disagree with that in terms of, at least from my clinical experience.
So, they're not going to complain of pain. A lot of them, like I said, they're gnawing sometimes. They're doing their hands together. So, maybe they can't communicate it, but, the point of the matter is they're not necessarily going to tell you that they have pain, and you shouldn't wait around for that.
No, I think we all agree with that. They're not going to tell you pain, but that's a part of this, and I think they also, historically, I think they've always had this carpal tunnel, and they don't appreciate what it's like until you get decompressed. And again, I think the message is we're not doing carpal tunnels as early as we should for a lot of our patients.
This is for Dr. White. The narrowing of the spine and the stabilization, after you stabilize, does the spinal cord go back and the spinal fluid can flow normally, or when it's damaged, does it not flow as normally as it should?
So there's 2 different scenarios that you just mentioned, and they're different. So if you have narrowing without damage to the spinal cord, then generally speaking, at least for the short to medium term, yes, the flow is restored. There's enough room. Now there are in Morquio syndrome, specifically kids who have not been stabilized after their decompression, they can develop narrowing again in about 50% of the cases. So
this is with Hurler and without an injury, just C1, C2, C3.
Yeah, and so so if you decompress it, generally it's better. Now, if you have spinal cord injury, meaning that you're already showing some weakness or numbness somewhere, Now, that may or may not come back.
Hi, Dr. White. This is Jason from Seattle. I probably could ask you this later, but I thought I'd ask now. I've been getting some conflicting information about whether or not enzyme replacement therapies, Vimizim in particular for my daughter's Morchio, is effective on the hard tissue, the bones. It's predominantly, I've been told, on the soft tissue, and I just wanted to get your take on that to make sure that's true.
So as far as deformity goes and arthrosis, it's hard to say that it's making a big difference. Now, it might be making some subtle differences, particularly with regard to inflammation, and I probably should let Lynda talk about that. But but as far as the true deformity manifestations in arthrosis, it's hard to say. But it may be that we're getting to some of them too late too, right? So we don't have a lot of children who were started at a really young age to really look at yet.
Well, I mean, I guess just in terms of the inflammation, if it's anything like 1, 2, and 6, we do still see inflammation regardless of ERT. So I don't have any reason to think it'll be any different for MPS 4.
This question's for Dr. Polgreen. On the joint stiffness and Humira, is there any type of age group, and is it reversible? So, like, hey, if they're 15 and beyond, post BMT, not in the clinical trial, or where does age play in the reversibility of it, and what you're thinking? I don't even know that the trials aren't done, but could you comment on that?
Yeah, we've enrolled people from I think about age 8 up to around 30. And so we've seen some benefit in all age groups. And so, I think in general, since we do think it gets worse over time and prevention is easier, we might not see as big of benefits in an older individual as a younger, but we haven't looked at that at all yet. That's pure speculation on my part. But we have seen benefits in young adults as well.
Hi, I am Carolyn from Southern Indiana, and I have Dan. He is 17 with Hunter syndrome. And I have a carpal tunnel question. So he is, I'm over here. Hi. Sorry, can't stand up. He has had carpal tunnel released 4 times bilaterally now. First time at 4.5, then again at 9, then again at around 13, and then again earlier this year. And it was very clear symptoms every time. He was biting his hands a lot. He was obsessed with running his hands under the hot water in the tub, like he didn't want to take them away. Like he just got a lot more intent on keeping his hands under that warm running water. So it was, every time we tested him, it was because of very clear symptoms for it. This last time, the 4th go round, the surgeon made the comment that most of his problem this time was entrapment of the nerves into the scar tissue from the previous surgeries, because his hands are so small, the space is so small, and it was to the point where the nerve was attached and almost embedded into the scar tissue. So at what point do you look at them and say, okay, their hands are so little, is it worth it to even do the surgery because the scar tissue has such a potential of coming back and causing problems later?
Yeah, that's a good question. So if you look at the Hunter outcomes study, there are multiple kids who have had recurrent carpal tunnel syndrome and needed more than one surgery. Most don't. And so I don't know why some do and some don't, but it seems sensible or reasonable that's what's happening in your son, but. So I don't know that until you try, to be honest. And he's maybe he has some unlucky biology, different biology that's making it different. So.
I want to thank the panel for answering questions. I think we're kind of right. We're right there on time. If anyone else has further questions, I know the doctors will be here for a little while longer today. So thank you very much. Let's have a hand for Dr. Braunlin, Dr. White, and Dr. Polgreen, please.